Hi, this is Dr. A. In this medical terminology video, we're going to look at the diagnostic and therapeutic procedures of the male reproductive system. Some clinical lab tests. We have the prostate-specific antigen on a PSA level. It is a blood test to screen for prostate cancer. And then semen analysis is part of a fertility workup. The sperm are analyzed for number, swimming strength, and shape. Some surgical procedures. Balanoplasty is a surgical repair of the glans penis. Castration is a surgical removal of the testes. Circumcision is the surgical removal of the prepuce. Epididymectomy is a surgical removal of the epididymis. Orchidectomy is a surgical removal of the testes. Orchidopexy is a surgical fixation of undescended testes in the scrotum. Orchiectomy is the surgical removal of the testes. Orchiotomy is cutting into the testes. Orchioplasty is a surgical repair of the testes. Prostatectomy is a surgical removal of the prostate gland. And sterilization is the process of rendering a male or a female unable to conceive children. For the females, it's pretty typical to do the tubal ligations, and for the male, the tubes that are cut and tied off is a vas deferens, and so that is a vasectomy. Transurethral resection of the prostate, TUR or TURP, is a removal of the prostate tissue by inserting a device through the urethra. A vasectomy is a removal of a segment or all of the vas deferens to prevent sperm from leaving the male body. So it's a form of birth control or sterilization. Vasovasotomy is the reversal of a vasectomy by reconnecting the ends of the vas deferens. And then here is an illustration of a vasectomy. So it's actually a pretty easy procedure because they can just make an incision into the sac, into the scrotum, go in here, cut it, tie both of them off, cut them, tie both of them off, and there you go. The sperm can no longer leave the testes, and therefore there's not going to be any children. And then lastly, for the pharmacology, androgen therapy is a replacement of male hormones, notably testosterone, like andronate or dipandro. Antiprostatic agents shrinks the benign prostatic hyperplasia, so a swollen prostate, like Proscar and Avodart. Erectile dysfunction agents temporarily produces an erection, like Viagra or Cialis. And spermaticide is a chemical that destroys sperm, like Simicid and orthodinol. This would be in the hopes of preventing pregnancy also. All right, that wraps it up for our male reproductive system. Thank you.